where we are today, we have a population of about 70% of Americans that want to be vaccinated, but there's not enough supply of the vaccine in the marketplace. In fact, 2/3 of Americans are not happy with the rollout. While we've made considerable strides with the movable middle, convincing that middle, the people who are on the fence about taking the vaccine into the category of being willing to take it, we still have a long way to go. So there's still a tremendous amount of work that needs to be done to convince people to fight the aspects of fear that may be present around the vaccine. And that's really where the healthcare marketer comes into being an important part in making sure that we get to the full vaccination.
So where does data targeting fit into that?
Yeah, so it's a great question. We have seen that actually when we talk about targeting, we talk about advertising as a mode to get people to do better things for their health. We've seen that actually demographics is actually 3 times more important in getting people to actually go on to a prescription or take a drug than even the creative messaging itself. So because of this importance of making sure that you have the right message in front of the right audience, we've seen the necessity of data to help us understand who we need to reach and with what message we need to reach them with. I think universally, most of the vaccine resistors go back to a sense of fear around the vaccine. And there's really 3 ways that we can help reduce those fears. And that's through evidence, optimism, and transparency.
Chris, tell us about reaching people who are underserved communities. We talk a lot about targeted marketing and addressable audiences. What does that mean, and what's the importance for the vaccine manufacturers?
Yeah, so there's parts of the population that have different sorts of concerns, different fears about what the vaccine may have. While we know that the science is sound and we know that the vaccine is safe, and now we have 4 vaccines on market, there still is this undercurrent of fear that we have to address through messaging. And I mentioned evidence, optimism, and transparency being those 3 kind of key points that our messaging today has to address. So what we need to do in order to really move the movable middle, we have to find messaging that hits those three elements and addresses the different fears that are interspersed right throughout the population. Because one demographic might have a different set of concerns than another demographic, and that's really where data comes in, is being able to identify and help to actually reach those pockets of populations across the United States, and to make sure that the message is most resonant, personalized, and custom, not hitting someone with the generic messaging, but being very targeted about the specific concerns that an individual might have about the vaccine.
So tell us, Chris, about your work, the work of Deep Intent, how that's changed during the pandemic, and sort of the demands on your services and how your business has evolved.
Yeah, so what we saw in our, across our client base was that, sales reps, pharmaceutical sales reps play a big part in the overall go-to-market and just consistency of just the overall marketing for our clients and their treatments and prescription drugs. So when COVID hit, a lot of our clients started to retract their in-person sales reps to going into the office and educating the healthcare providers and the other healthcare facility and staff. With those retracted, there was a gap in the communication and actually the ability for the pharmaceuticals and the science community to receive new information about new drugs and treatments. So what we found was that the only way to do that was through non-personal promotion, and marketers at our clients increasingly turn to digital to actually be able to reach healthcare providers across the United States. So almost as a function of the pandemic, we've seen an increased step up, and in fact, a 3x step up in terms of the demand for our services to help identify and reach those healthcare providers with messaging. On the flip side, on the patient side, with more people stuck at home, people are streaming more than ever. So we actually saw a massive increase in the connected television space and demand for CTV, in addition to just general digital advertising. So with our platform, we're well positioned, right? We have technology that we've built to help identify patients based on conditions in a privacy safe way. We also have the ability to reach healthcare providers on a one-to-one way. So, by having these capabilities, we offer a solution that helps supplement kind of the lack of having that in-person communication or sales rep seen across the table, and effectively delivers that message that needs to be heard.
And as a DSP, what are your clients looking for? What are your the buyers looking for? What do they look to you for that they wouldn't look for to one of the other DSPs?
Yeah. So what we have is, we kind of take stride and differentiate on kind of three main pillars. We help with planning, activation, and measurement. And we've built tools for all three of those pillars that are healthcare specific. So when you're trying to find the right physician to market to or the right patient to market to, we provide tools that allow our marketers to do that using clinical data in a privacy safe way. And so once you find that audience, it's really simple to move that right into our DSP, serve media against them, and not just serve media against them, but actually measure which creatives, which strategies, which tactics are actually driving the back end clinical performance or health outcomes for the patient population that they're looking to reach. So in short, it's a all-in-one platform that is built specifically for healthcare, which is a bit unlike some of the other DSPs that are out in the space.
And finally, Chris, what's the roadmap ahead for Deep Intent? How do you see the next 12 months, both organizationally and in terms of business reach?
Yeah, so organizationally, we've actually doubled in size since the pandemic, and we plan to double again in 2021. We've been growing. This will be our fifth year of 3x growth. So the demand for our products and services are only increasing. And we think that digital has been coordinated as being the primary way for our clients to reach their audiences. And so we continue to invest heavily in products and solutions that are going to help them connect in a more efficient way with those audiences to drive better health outcomes. So our entire product roadmap for 2021 has more or less been planned out, but we are super excited about what's to come, and we have a lot of big announcements coming later this year.